Hey everyone, this is Dr. Tay, and today's episode is on posture. There was a 1 week hiatus. I just got back from Mexico this past Wednesday. I was away with my family, but here I'm back at it for our weekly videos. All right. So if you look here, this is from Key Body and Spirit, where Nikki and I just taught posture class, one aerial version, one more engaged directly targeting specific muscles. We're teaching this thing called Unified Posture Program. And for those who are attending the class, this is the video just for you. And if you're just tuning in, this is a great video to get a lot of information about posture. There'll be a two-part video for this. Today is part one. And if you're watching this video, look for the part two. All right. And I'm on the corner page on the bottom. All right, posture brings about a lot of different things, especially neck pain and lower back pain. And a lot of healthcare providers trying to address neck pain and back pain. However, they're not addressing posture, and it's not their fault because it was not in their education system to really fix this. In fact, a lot of the textbooks that I look at, posture is literally oftentimes one page. One book I found was literally 4 pages, and part of that page it was this picture right here, which really does not give a proper presentation of describing these postures. We have a spoon flat back posture, rounded shoulders, right? This is a leaning tower where the head leans forward, and arched back, especially when the hips are really extended backwards. And a flat back, this is not a good picture because it should be more flat and the head should be leaning forward. So these pictures are not a good representation of what it should be. In fact, a normal posture is not properly aligned. A normal posture is where the ears, shoulders, hips, and ankles are supposed to be in one straight line, and this posture is not doing that posture justice. Okay, this is a good picture of a flat back with a rounded shoulders and forehead postures. Oftentimes, the flat back causes all of this. However, it can be caused by extended periods of time of leaning your head forward over a period of time. In 2005, they found that performed a research study analyzing MRIs. Their research indicated that 439 13-year-old children who had an MRI of their lumbar spine, 1/3 of them presented with lumbar disc degeneration. And this is happening for the first time in human history with the introduction of smart devices. This is the modern day life. Everybody has a smart device that their eyes are glued to. And this is also a wrong picture. The device should be angled, reaching, the top of the device should be reaching the eye around here. So this is off, and this is the incorrect. So this should be both incorrect. And the way is not the smart device, it is your posture that is generating what is bad. So this is a better picture. The artist knew what a posture should look like. The eye level should be close to the device, top of the device should be close to the eye level. And when it's done like so, there's about 10 pounds of pressure exerting onto the spine straight down. When it is 30 degrees forward, it's exerting about more than 30 pounds of weight. If it's 45 degrees, it's exerting about 50 pounds. And if exerting at 70 degrees, and you see this posture a lot in airports where people are sitting down, and is exerting a lot of pressure due to the weight of the head on the spine. And these muscles, being in this position for a long period of time, blood cannot go in there because the muscles are so tight being in this position, and the muscles become dry and later on becomes developing knots. You can't blame your mom, your school, your church, your healthcare providers because they were never taught proper posture anywhere. Except for maybe like Taekwondo dojos or martial arts school, the instructor's like, oh, you got to get your posture correct. It's a modern epidemic on the rise, but the root issue is not being addressed. And office syndrome is a combination of headache, neck pain, shoulder pain, backache. Now, if you lean forward like this, which is the forehead posture, you cannot raise your arm all the way up. And people who live like this eventually around the age of 50, they get a frozen shoulder and they can't lift their arm. And sometimes it's a calcified frozen shoulder that leads to that. Gaskin and Richard in 2011 estimated that about $300 billion per year are spent on A, healthcare, being addressed of neck and back pain, two, the productivity loss at jobs and businesses because of people experiencing neck pain, back pain, slowing down businesses. And the entire cost is about $300 billion, and this was more than 10 years ago. My training in school, even in my school, my education, uh, people talked about posture out of the 4-year program, maybe one day. That was about it, right? And neurologic function starts at a young age and requires focused attention on your daily posture habits. So check your posture. And one way to check your posture, which you will not get information, not even in this presentation or anywhere else, it has everything to do with your breath. Proper spinal alignment helps prevent neck and back pain. People with low back pain have different postural stabilization patterns and move differently. Exercise improves brain health, obviously, because it has everything to do with your breath. Pain is an output of your brain, not your body. This is the conundrum that people have. If I have pain on my elbow due to tennis elbow, right here, and my body is causing the compression, but the pain is coming interpreted in the brain, not the muscle. Posture assessment and treatment may assist in diagnosing and treating depression. Why? Because depressed people do not stand up straight. They push their head forward and shoulders get rounded, and then they sit back. And this is what a depressed person looks like because they keep their head down. In fact, being in this position, my lungs cannot fully expand in this rib cage, and therefore I take shorter breaths, right? Which definitely leads to depression. So, posture affects breathing. Low breathing causes depression. So, try to connect those three relationships. Fibromyalgia patients present with flexor dominant posture and commonly feel fatigued faster. Same thing. If my body is flexed, not extended, but flexed, you fatigue faster. Why? Because you can't breathe into your maximum capacity and you need oxygen to go into your body to energize your body. And if oxygen cannot go into your body, which will have less energy, that means you're fatigued. Parkinson patients use a posture second strategy and treat all elements of a complex task with equal priority, which in daily life may go at the expense of maintaining balance and leads to falls. Meaning, medication is the top priority to treat Parkinson's disease. However, their balance has to be worked with their physical therapist or their personal trainer or whoever the healthcare provider that leads them to not have falls. Posture affects all human functions, both consciously and subconsciously, from breathing to thinking. I beg to differ that it is the breathing that affects posture. And there's two types of breathing. One is subconscious breathing that we're doing all day long without thinking, just breathing. However, conscious breathing, I chose to breathe like that. It's not an autonomic function to breathe that way. But because I choose to breathe in that fashion, I'm generating internal pressure. That internal pressure is moving my blood, my circulation to the periphery, my hands, my feet, and my prefrontal cortex. And more of that blood reaching the prefrontal cortex can get that part wet, and the red blood delivering oxygen. And the brain is a very fatty brain, and therefore it combines the oxygen and fat through the Krebs cycle, converting ADP, adenosine diphosphate, to ATP, adenosine triphosphate, which is the energy currency of the body. And by waking that part of the brain, which is the human part of the brain that we possess the way no other animals do, it is where joy, happiness, problem-solving skills, and executive decisions are being made. And that part of the brain has the highest concentration of mitochondria anywhere in the body. In fact, the body craves the person to breathe a lot to activate that part of the brain more and more and more. Postural respiratory balance and improved homeostasis can be taught through gravity-centered breathing. It's a fancy way of saying abdominal breathing, because as soon as you breathe in, if you expand your belly out forward, your diaphragm can defend, therefore is gravity centered. Because if you're leaning forward and breathing, that's not gravity centered. So you have to be standing up straighter. And if you don't have such good posture, all you have to do is breathe in and allow your body to change. The key word is you have to allow. You can take a deep breath in bad posture all day long. However, if you're aware of your body, let the breath expand. It optimizes your body through the gravity-centered breathing to a better posture. Reduced walking speed and arm swing and vertical head movements are associated with sadness and depression. Yes, this is a research associated with that. However, forget the sadness and depression part. Remember this part: reduced walking speed and arm swing and vertical head movements with posture. Meaning, if you have good posture, your arms should swing better and you should feel less weight on your feet, landing on your heels, and having that convex movement, and then your toes pushing you forward. In our posture class, we do a walk around the chairs before we do certain stretches and after we do certain stretches. And when you do it properly, the before and after should be noticeable, meaning that the stretches you do and the exercises you do should allow your breathing to be much better. Inclination of the head and shoulders and protrusions of the shoulder indicates higher levels of sadness and depression. Once again, I'm going to beat this horse to a pulp. Your head leaning forward, your shoulders rounded. This leads to depression and sadness. And if you take medications in this position, you may get the happy chemicals inside your body, but guess what? You're still feeling sad and depressed. So one way to fix that is correcting your posture and using your natural built-in mechanisms to access that part of the brain, which requires deep breathing and sending a lot of oxygen through your red blood cells to that part of the brain to fire the happy side of the brain. Brain-based posture correction is the way of the future in healthcare as a gateway to prevention. And I believe that yoga, Pilates, all of these things are for the sole purpose of fitness and flexibility, but is not geared towards posture. All right, I will have more video like this, part 2 next week, but chances are there's going to be more parts to it. I just want to get the overall information out there. And sometimes these things that I'm saying, if you don't practice it, there's no revelation, meaning you will have knowledge but lack of understanding. Thank you, Jules, for that quote, right? You'll have knowledge but not understanding. All right. So please hit the like button, subscribe, and share these videos, and hit the notification bell to be alerted for our future videos. All right. Thank you so much, and see you guys next time. Bye.